my name is Mandy Sorensen, and this is my leadership action plan. So my problem is admitting high acuity patients with an already full unit. So when we admit patients who really need extensive cares, and we already have a unit that's full of patients that have extensive cares, there is going to be a give and take with that. And this matters because patients just aren't really getting the care they need in a timely manner. And this impacts everyone, impacts the entire discipline, like health team, physical therapy, management, nursing, aides, and obviously patients and their families. So what's the plan? Something that I've learned along this semester has been when small steps are taken, big accomplishments can be met. So some of my small steps are to have patients fill out a get to know me form so that we're not wasting time, or not, it wouldn't be wasting time, but we just don't have the time to go in and talk to patients and get to know them. So having something that's already kind of a baseline is established would help us. If a patient has a certain routine or certain idiosyncrasies that they like, having them provide that to us ahead of time will just make a smoother shift. Also, do a suggestion box where patients or aides or nurses can put in suggestions regarding patient's care or things that would help the shift move smoother. We should be making farewell posters where I work at a rehab facility. These people are with us up to 6 months sometimes, and it's nice to, we really get to know them and care for them. And so I think doing a farewell poster kind of just is that last impression on them from our facility. In order for staff to come to work excited, sometimes you just need a couple people to come to work with a positive mindset, and that can change the whole shift of it can shift the whole mood or vibe of the day. And so I think having like little incentive gifts for those people that can do that would be a good idea. And then get some of the back managers who have worked their way up, such as the DON, admitting nurses, discharge nurses, wound care nurses, get them to come out on the floor for an hour of their day. Help the aides, help the nurses do some treatment and that kind of stuff, so that they can get a feel for how the acuity truly is, because sometimes that's not the case when they first admit a patient. And why does this change matter? Well, this change matters because we all want to go to work and enjoy where we're working. But mostly it's because of improved outcomes. We want our patients to feel like they're getting taken care of. We want them to feel comfortable. We want them to make sure that their needs are being met in a timely manner. And that all happens when we connect with these patients. Our nursing experience is enhanced. So most people get into nursing because they want to help people. Under time constraints, sometimes it feels like we're not really helping. We're just running around like a chicken with our head cut off. And so I feel like if in a timely manner, if we have these, some of these plans put in place, that we won't feel that way. And the reason why we got into nursing will be evident. And then also just to have a standard report sheet. I think this is it just helps with the consistency of communication from the hospital to the admit nurse, to the CNAs. So who we know, it's all about who we know, right? That's what people say. And so appropriate communication is just really important. I chose a CNA at my job that her name's Candace, a swing lead who's also a CNA but is over like the shift that I work for CNAs, Johnny. And then I also interviewed a fellow registered nurse, Becky. How did we communicate? We communicated initially. I told them about the assignment. Told them I would be interested in just kind of picking their brains about some things. And then after that, we really just texted because I wanted to respect their time and life outside of work. And so the process that I really thought about before going into this was that I wanted to talk to people who weren't going to just bash the facility or who didn't want to just complain about all the things that weren't happening. I wanted people who had opinions and who had a desire to make change within the building. And so collaboration really matters. You need to kind of have some key people on each unit to really make it work. So team input enhances patient care in the work environment. It fosters ownership and accountability amongst all the nursing staff. It leads to more solution, excuse me, and improved patient outcomes. Open communication really boosts morale because everyone feels like they're being seen and heard. And then overall, it just reduces burnout and turnover among the nurses. My thinking has evolved in a way that I feel seen. Even just talking to these 3 people and feeling like they have a desire to make things better too, has just helped me not feel as stressed at work. My facility has a lot of new nurses, and so it's important for us to continue to keep growing them and encouraging them. And so working with those who I really trust has really helped me become a better nurse. So contributor impact. Here I have the 3 people I interviewed, their action items, and I'm just going to go over a couple. Candace had said like high acuity and high census is really hard. And then also like the management needs to set realistic expectations with the patient and the family. Johnny said the patient to staff ratio is not okay. And then Becky said that there just needs to be a clear and concise communication. So some of those solutions were have admitting nurses and floor nurses meet to discuss what the census really looks like. Have management be honest about expectations. Hire more staff when the census is high and acuity is high. Give feedback to the admitting nurses, and then learn more about each patient to give correct care the first time. So some of these setbacks is that like carving time to do some of these things and to get all these meetings is a difficult thing to do. Our census may drop, which means that the expectations are being met. A financial strain for the like hiring more staff, and like what happens to that staff when the census goes low. You can't just fire people and hire people as it fits our needs. And then having admitting nurses help on the floor to get the feel for the acuity. So one thing was like the high acuity. It's just that was the main issue I found. And then the management setting realistic expectations. It's just probably not an option because of marketing and the bottom line. And then this idea helped to be the solution for the high acuity. So the clear and concise communication. So my personal growth, I consider myself a transformational leader. Ownership is huge for me. I value honesty, integrity, accountability, and hard work. I really liked that during this, I was able to use my creative mind to come up with ideas on how to better our patients' outcomes. So some developed skills were not bashing the facility, working as a team towards the same goal, being the positive poly on shift. My BSN goal is that, like I initially spoke face-to-face with these people. I've also talked to many patients about some things, like when they're complaining, I've said like, well, what do you think could make that better? And then just kind of carrying this into the future. I think that small steps in the right direction can create a radical change. Movement is the key because you're either going to fall back, which creates burnout, or you're going to progress forward, which helps you to become a leader. These are all my references I have included. I appreciate your time and I hope you have a good day.